with that, I'm going to start with the presentation, and I welcome your questions at any time. So if I'm going through the presentation and questions come up in the chat, Steve, and you want to read them, I'm perfectly fine with that. Okay.
Sounds great. Thanks. I'll do that.
So we came up with the motto slogan, get it, spend it, keep it. So what do we mean by that? So we wanted people to get the increase, for them to know, you know, if not on WIC, sign up and get it, use it, spend it, go cash it. That will help us keep it. That will help us, and I will work on that more as I'm doing the presentation, giving you more inside information. And you can help these families to connect to WIC and be able to also get the summer food benefit, because it's a temporary increase for right now. So we want them to get this increase as well as all the other WIC services. With that, very quickly, if it allows me, okay, there. So the WIC families get more than triple the benefits of fruits and vegetables for the summer. And what do I mean by that? So a family that has a baby over 12 months and mom who's pregnant or breastfeeding, we're getting from $9 to $11 a month for each person in that category that I mentioned. With this increase, they're able to get $35 of fruits and vegetables. So that's what happened in this summer, and this is what they're getting. So we're really happy to share and to encourage you to tell families about this. Let me go to, okay. So we really consider now to be the best time to be a WIC participant. And why do we say that? Because we got the WIC card. They have a card that works like an EBT card or an ATM card that they get used at the market. No more stigma about using those old checks that they, you know, used to identify people as using WIC. Not that it's a bad thing, but people felt sometimes stigmatized by that. So we're really happy to be able to offer the WIC card. We also have, when the card came, we added what is called the WIC App. So the WIC App, it's an application they download in their phone, and they're able to check for their benefits. So they also get increased benefits this summer. They get remote appointments so that we're able to serve them being at home. They get a website called withhealth.org, and I'll tell you more about that. And then we connect them to resources, agencies like yours. That's one of the main things that we're doing. This is what we really have intensified and working on during this time for our families. So let me go to my next screen. So, you know, pandemic silver linings. So what were the good things that happened amid, you know, all this awful time for many families? So for some of the good things that happened at WIC is that we got the card right around March 2020, which is when COVID hit. So we were able to work with their families and give their benefit remotely. You know, because it was a public health emergency, USDA granted waivers that allow us to do by video or phone appointments. And those were approved rather than having families to come to a WIC site. We were able to serve them via phone and video. So they could stay home. And so we had our campaign then, you know, stay safe at home and get benefits by phone. So we did that during some time. We saw, because of the need, a high increase of participation, which was really great to be able to help the families. And WIC became more accessible than ever. So this is the time when we had been able to really provide these services when they needed the most. So what's happening right now with the funding from the American Rescue Plan Act of 2021, that was signed into law in March 11, as you can see here in my screen. And WIC got 490 million that were given to all the WIC programs nationally. The funds are used completely to provide the fruits and vegetables for the families. So this is going directly to the families. This is money that is not going anywhere else for administrative use. It's just going as a benefit for the families. Therefore, from what I mentioned, from the $9 to $11 that the families were getting as a benefit for fruits and vegetables, now it's 35. This allows us to do that. But that's why it's temporary. That's why it's only a temporary thing. It's a one time that we get this money and it's going for the benefits of the families. So another thing that is going to be happening is improvements to the shopping experience will be coming up soon. We'll be happy to share at that point what improvements will those be. But we're talking about ordering online your foods like you normally do. We're talking about just different things that will be a great benefit to the families. So, you know, imagine a mom who's not able to leave home, they can order online. Right now there is a pilot project, but the families have to go and do curbside pickup. But again, they were not exposed to going to the stores if they participated in that pilot project. But again, that's an experience that we want to make permanent if we can. Okay, so those are things that we're working on nationally. So how does WIC provide remote services? So how do we do this? We want the families again to stay home. Right on the picture, there is a phone number, which is the state number and the website to the state, because we have other agencies and we want to be inclusive and we want to make sure that you're referring people to the right places also. But we are connecting right now families via phone and text. And I believe that most of us are doing that. We are doing nutrition assessments and we provide the nutrition education by phone, or we send them texts or links, you know, video chat and online education. And we do all this. This is how we do our remote services. If families need to share something with us, we send them a link and then they can load either an ID card or send a video chat to see their baby because the presence at CERT was needed. But the waivers are allowing us to do that, and that's how we are servicing them. We also assess for food insecurity, and what that does is it helps us to be able to refer to other services in the community. And as part of the process, whenever we are certifying families or whenever we are reassessing their them being able to stay in the program, and that's when we do it. So we load the benefits to the card, all this remotely. They don't need to come to any office. And we provide mainly a listening ear with empathy, and we give boundless support, and all this is remote. And you will see what I'm saying, you know, the boundless support through some of the slides that I have here, which, for example, we said you're friendly with counselors that only a text away. And, you know, we did actual screenshots of the texts that we get. So, you know, we send a text and we said, WIC, we missed you at your appointment, phone appointment, and text one to reschedule. So they text back and, you know, I'm available right now. Great, my name is Liz, and I'm gonna call you in the next few minutes from an area 626. So they recognize that is WIC, and then we talk to them, you know, and then somebody texting us. So that in the middle is one of our people that work. Most of our staff, which I wanna say, it's not only a few people that work doing the text, it's most of our staff across the agency work doing this. So this is the way, rather than servicing in person, we're doing this by the text or by the phone. So then somebody says, could you change my meal to lactate through, you know, she sends a text. And we said, request completed, like right away. And remember to spend your benefits before they expired. Have a great day. And like, wow, that was fast. And that message, remember to spend your benefits before they expire. The reason why we send that is because we want to keep that extra benefit that I was telling you. We are reminding them, use it, spend it, don't let it go to waste. Sometimes families forget or lose the cards or whatever. So we're reminding them. It will be great if from your end, when you talk to the family, say, hey, have you used your WIC benefits? If not, use them. So Okay, here is, oh, we had to throw this right here. That joke's welcome at WIC, okay? I was listening to Steve, who was sharing about the dad programs or father's programs that you guys have. We at WIC have also a father's program that is run. We just had few sessions with them. And I wanna share this because we really welcome dads at WIC. And we really have to work hard. WIC stands for Women, Infant, and Children. There is not that in the picture, right? In our name. So we have to really work hard to try to make them feel inclusive and be, at the offices. And I would say very happily, right before COVID, I used to go help at the centers. I was helping at the centers, and I will see so many dads, which was really, really great to be able to see that dads were picking up the services for mom. So even if mom is pregnant and breastfeeding, who qualifies, and the baby up to the first birthday, dad can pick up for them. Postpartum non-breastfeeding parents up to 6 months after they give birth. So if there is somebody who had a miscarriage or loss of pregnancy, they definitely qualify for 6 months of benefits, and please share that with your families. Infants and children up to the 5th birthday. All foster children under 5 years of age qualify for WIC. So as I mentioned, we welcome fathers, step parents, grandparents, and whoever is taking care of the kids to sign up and participate on WIC for them. And I want to make just a little stop right here to see if there are any questions, Steve. I'm not looking at the chat.
Yeah, not in the chat right now, Pina, but yeah, if
Okay.
anyone has anything, and I think probably okay with you if people unmute and ask a question real quick too, if you're not comfortable.
Sure, I will be fine with that too. Yes.
Okay, great.
Okay, so does WIC have an income threshold? Yeah, we do have income limitations, but a family of 4, as you can see right here, a family of 4 can participate in the program and make $4,086. So you can see it right here where my arrow is pointing. So families who are receiving CallWorks, TANF before, Medi-Cal, they automatically meet income requirements for WIC, so they qualify for WIC. Many working families, 1 out of every 2 born babies in the US qualifies for WIC. That is a high number, and they're not all participating. And I don't know if you knew, but LA County has 40,000 families in LA County only. They qualify for WIC, but they don't receive these benefits. And it will be great if they did. And you can help us close that gap. You can tell them. I'm going to tell you a little inside information. Many families, if you ask them, they might say, oh, I am on WIC. I'm already receiving WIC. And what they mean is that they signed up maybe a year ago or 7, 8 months ago, but they haven't participated lately. They haven't come back. We got to the extent to get moms who were pregnant, and she's coming to WIC in the 9th month of her pregnancy, sometimes until the baby is born because of a referral done by maybe some of you. And she has a 3-year-old child receiving WIC. So we ask, how come you never shared that you were pregnant? Because we're not seeing them, and then she said, oh, I thought they were closed. I thought that only my child qualified because I went to apply for him before. So that's some of the mentality. You can help us close that gap. You can tell people about our services and what they're getting right now, those $35, which is really, I think, a great benefit for them. So please share. So WIC has the nutrition experts at your service. People could pay for nutrition advice and nutrition counseling and pay very stiff money, to get a consultation. So WIC has registered dietitians, nutrition professionals. The counseling for nutrition information is provided over the phone. And we do this when we enroll the mom in the program every 6 months, and more often if there is a high risk individual. So let me share, like somebody who has a child who's anemic. So that child is going to get more follow-ups more often as needed. Or anytime they also have a question, they can also contact us. And again, we have the website wicchealth.org, which has online education information on many topics related to family issues that moms sometimes are having a hard time, finding information. WIC, our agency, started doing also video group education. So rather than having a classroom, we're doing something like we're doing right now, exactly like this. So we give appointments, moms sign up, and then we have the classes online, which has been really great and well taken. So that's for our nutrition information. Resources for nutrition, pregnancy, child development, and more. And as you can tell right here, don't those pictures look so beautiful, like they're out of a magazine? These are our pamphlets that we're giving our families. So this is what they're getting. And right now, because we're not seeing them in person, we send them this via link. So you need to know more about your pregnancy. Here is this information, this pamphlet, and we just link it to the text on their phone, and they can open it to see and read it in their phone. Even better to keep it than a paper, because sometimes the paper gets thrown away or lost or whatever. So, and then moms need to know stages of growth. So we provide them with that information. The other thing, we have our WIC nutritionist also answering their questions. So if we have a question that is related to nutrition, the nutritionist will say, and like, for example, in this says, hi WIC, can I give my toddler fish? And that is a question that, I don't know, some of us who might not be nutritionists might think, is that okay or not okay, right? So then our nutritionist answers, great question. Yes, fish is nutritious and most safe for kids to eat. Here is some information about choosing safe fish options for kids. And then we give them the link of where to go. And, very informative. Thank you. Again, our nutritionists, our people are only a text away. I'm going to repeat that again, because I really consider that that is important. And these are things that you can share also with your families. So here is my next slide. I was mentioning about wicchealth.org. So this is a website that the state created, and we really call it the hidden gem for participants. WIC participants can sign up for this if they are receiving WIC, because they need the WIC ID to sign up for this. But they could get so many things out of this website. I went there myself, and I was reading some of their classes and the recipes, and I downloaded a couple because I thought, oh my God, this is really good. I didn't even know I had to use my fake ID to pretend that I'm a WIC participant to go in, because I was allowed to do that. But our families can get this. They can get tips, they can get recipes, they can get just so many things that they need during that time that is so crucial. The one thing that we consider that is so important to this is, if we are having a mom where she has questions about nutrition or so forth, she's limited to our hours of operation, which it could be 9 to 5:30 or so. This website, she can go in at any time, especially moms have kids, probably don't have much time during the day. So anytime she has access to go to this and read all the information. So we give them this information. So going to my next slide, which is about breastfeeding services and support. So our lactation consultants, our peer counselors, our breastfeeding professionals are providing, again, this information on the phone, text messages, video links, and video chat. And again, we do this basically when we enroll the mom through the pregnancy. We do this when the baby is in the early period as newborn. We also do it through the first year because it's so critical, especially first-time moms. So we consider that they need all that support. And then again, we provide the information about the wicchealth.org online education, which is really great. And breastfeeding support circles by video. These are classes that are breastfeeding, and we have it in different languages, several languages. So families can choose of the day and the time, their own language, and sign up for those breastfeeding support circles, so which is really great. Okay, so more about breastfeeding services and support. So the breast pumps could be mailed or picked up at a WIC site. So if they're going to pick up at a WIC site because they're urgently needed, they need to make an appointment. So we make an appointment so it's safely done. We also have the infant scales sent to breastfeeding moms. We either mail those or they pick them up at a WIC site also. And again, consultations with our lactation specialist. All this is done via FaceTime or video, Zoom. And great news, in-person breastfeeding consultations by appointment will be coming in July. So we're gonna do appointments for moms who are having issues with breastfeeding that they really need to see somebody, because it's just a lot easier to do in person. So we're taking safety precautions for mom and for our employees, but we're starting to do that, which is really, really nice. So my next slide is WIC connects families to referrals, resources, and support. And I'm very happy to share, that our empathetic and knowledgeable WIC staff assesses every family situation to provide additional referrals. So we have plenty of resources, such as, rent relief, information on mental health resources, community food drives, diaper distribution, any events that are supporting our families through these difficult times, we are sending them that information. Medical and other services, we feel that they're more critical than ever. So if you as an agency have information about something happening, something specific to an area, to a date, you can send it to us. And again, I would like maybe Claudia to share at the end how they do the resources. What I'm sharing is for PHFE WIC, and Irene maybe can also say at the end of the presentation how you guys are referring people to resources. Our agency is sending those via link. So if you are an agency that is doing a food drive or a diaper distribution, and you have a flyer saying on this date from this time, families can sign up, they need this and this and that, you send me that flyer and we'll put it through a link and it will go to the families. If it's time sensitive, we send it via link. If it's an ongoing thing, we will put it in our website and we will put it in the resources where they can keep it and see it as a resource. So all these resources and referrals are offered via text, on the phone, or through web links. So I really welcome you to encourage your families, to access also our WIC information. And I'm going to go to my next slide, which will tell you how easy it is. So even for those that don't qualify for WIC, they can still use our resources. So our website has lots of information and resources. So they need to check on the Learn and Grow tab, and then they go to Family Resources section. So like I did that myself. I went in and I put that I was looking for food, and I put my zip code, and right around me, there were several agencies and community organizations that were doing something with food pantries or food distributions, and they showed in my screen. So this is how easy it is to access. So that's what I was saying. You can tell people about this. We have many resources. We have information about our program little by little there. So we have just a wealth of information, which I invite you to share with the families about the website where they can get more resources, because they need them so much during this time. And again, they don't need to be on WIC, but if they are, even better. And if they qualify and they're not, please tell them to apply first. Okay, so here I go to our wonderful WIC food package. So because pregnancy and child development, growth and development are so important, we strongly believe that nutrition matters. So, WIC foods are very selected to provide some key nutrients during the time of the most important growth. And I know I'm preaching to the choir, because that, babies or pregnancy and babies need this good nutrition, and all the WIC foods are healthy foods. Eating foods regularly, the WIC foods, leads to a lifetime of great choices. So we call it Eat Like WIC because of the healthy choices that they have in the foods. And again, because of the nutrient density, that they have in these foods. Not that other foods are not good. Also, they are good, but sometimes they might not have the same nutrient density. And that's what we really look for when they need it during these critical periods of growth. So looking for healthy options at the grocery store. We're saying, look for the WIC food tag. Most markets have tags now where they can you can just see WIC. I mean, I go to my market and I see it there all the time. So just a little tip there, okay? So making shopping for WIC foods easy. I did mention about the WIC app earlier and why it was so good right now to be a WIC participant. So we released the app when we had the card, but they just updated and they came with a much, much better version of the app. So we had heard from participants, oh, I want to do this and doesn't do this or doesn't do that. So we gave all the feedback to the state and the state was working on that. So just to show you, so let's say that I am a participant and I want to use the cheese and I click right here, right where I have my cursor on the cheese, a list of all the kinds of cheese I can buy will generate. It's a pop-up that generates there. So it's really easy, really convenient to use. But the one thing I wanted to illustrate is about the change. Remember I mentioned earlier that the benefit was from $9 to $11. You can see the 9 is very small. I hope you see it. And it's just money. That's the food, the cash value. The cash value was $9. But now this is the month of May to June, the month of June. So here it is, June, they were able to get now those $35. So they can see that already in their app. So here is more features, more wonderful features for the app. So they have appointment reminders, so they don't forget that I have a phone appointment with WIC. They can see what foods they have available and the balances. Like if they had the $35 of temporary increase that they're getting right now, they already got it, and they spent $20. It will show that they still have $15 left. So they can remember to use it. So scanning for food items. This is something that we're really happy to see that what foods are approved. I had witnessed moms who were shopping, who would be at the checkout counter and feeling embarrassed because they had the wrong food and they had to go back and people were looking at them. Oftentimes I advocated for them. However, I wasn't there every single time. However, with this scanning ability from the app, it will they use it, as you can see in the picture right here. She has the phone right here. She's getting a can and she's scanning, and it will, if it's okay, it will say WIC approved. So families know exactly I am buying the food I could buy or I should buy. Office locations are also, you can see right here in the picture that it shows all the different office locations as well as the groceries that are approved. So it's a really wonderful app. We're really happy to have that. So what are we talking about today? This is one of the things I really, really wanted to stress. They get more than triple the benefits, as I said that before. The increase is to $35 for fruits and vegetables. And we're saying, if you're not on WIC, get it today. Please share with your families. Tell them about this extra benefit. So just imagine, because right now it's only available from June to September 2021. It's for 4 months. It's seasonal. It's just for that amount of money that was given to us that is going to last us those 4 months. So a family, let's say that there is a mom who's pregnant and she has 2 kids under 5, that it's 3 people that can participate if they qualify. So those 3 people, between the 3 of them, if they would look at their app, when I was showing you where the value would be, it would be $105 because it's $35 each that they get right now. And again, this is temporary. This is only until the month of September 2021. one thing, and I think it might be good for you to know, because sometimes you might have questions from the people that you're seeing, and they said, oh, I got my September benefits for fruits and vegetables, but it's October. Can I cash them? They absolutely can, because if they got their benefits, let's say September 2nd, they're good until October 1st. They got in September 3rd. They're good until October 2nd, and so on. So it's 30 days of those benefits that they will be able, so they not, you can help clarify so families might not get confused and think because September passed and the benefit was only until September 2021, I cannot use it. They can still use it because the benefit shows the date when they received it and is good for 30 days. So that, I thought it was a good piece of information for you to maybe share with some families, or in case that you might have questions. So the best part of all this is that you can help make this increase permanent. And again, here I'm going to our slogan, get it. If you're not on WIC, sign up and get it. The families who are on WIC, by the end of June, everybody who is on WIC will have received it if the records are up to date. So, and they will have received it by the month of June. We are saying spend it, use it, don't let it stay. It doesn't roll over. So if the family didn't spend it this month, does it roll over to next month, to my benefits of next month? No, it doesn't. So if you got it on the 15th of June, you have until the 14th of July. And if the 15th of July comes and you didn't spend it, or she didn't spend it, it's not going to roll over. She lost it. So we're saying, please spend it, use it. That will help us keep it, So we, and we said, how can you help us make this increase permanent? So we said, WIC participants spend all your benefits every month. And everyone, you can tell your members of Congress that you love this increase. So Congress will vote on the federal budget very soon. And if families show that they want this, that they're using it, that they're actually using the benefit, they're spending it, this might become permanent. So we were, last Friday, we had the Appropriations Committee meet there is a proposal to extend it 1 year. We haven't heard much from that, so we don't know what it is, but families spending it and using it is definitely going to help, because then they will see that families really needed it. And families were asking for it, actually. Families were saying, how come I don't get more fruits and vegetables? I had a session in Spanish last week where families were saying, how come I had to pay the benefits if it's supposed, for the fruits and vegetables, if it's supposed to be free? Well, if you get $11 in fruits and vegetables, which was before June, and you're buying $15, you pay the difference. So it's like WIC gives you $9 or $11, but the difference before you needed to pay it. Well, now you have $35, so you wouldn't have to pay. So that the families were asking for that. And please help us, share it, help us to help people so it becomes permanent. So, we can't wait just to see everybody in person, even virtually for those who prefer to be, but it was just so wonderful to welcome our families, to see them in our seating area and talking to them. And, it just, WIC has always been such a great place to connect with families. And we were so happy that WIC has been such a trusted program by the community that they didn't even just come and get their food or information just about WIC. They will come and ask us for a lot of different things. They will come and ask us about immigration issues. They will ask us about doctors. They will ask us, just so many things. And this, I know, is through the agencies. It's not particular to one agency, but WIC has been that really beautiful environment. So that's when we say, we can't wait to see them again. We want it to be safe again, but it's very likely there might be a hybrid program again. Maybe some of those who choose to be seen virtually will do that. And for those that come, again, we're in process. We're not open in our agency yet, just for those that were setting up appointments for breastfeeding issues. But, you know, families can get their WIC foods and services just within few days of applying. And this is the best time. They can join WIC or they can come back if they weren't active. I mentioned earlier that if families tell you, I am on WIC, but they haven't come, if you can prove and say, when was the last time you got your benefits? When was the last time you used your WIC? Probably will tell you that they might not be active, some of them, you know, and we want you to tell your friends about WIC, your patients or your families that you see in your programs. Help us spread the word in your community. And we definitely do the same thing for your programs at WIC. That I can tell you, we pass this information. So I'm asking you that we work together so we can, you know, between our agencies, ensure the families are getting more benefits. So in-person appointments will be limited. And of course, it's because we want to do it gradually and safely. And, you know, we will send some special invitations for families because it's going to be only on-site appointments. And as you can tell, and if you had ever been to a WIC office before, there would be times when it will be really crowded. Really crowded. I remember working right at the rollout of the card, and oh my God, we even had people standing up because we didn't have enough chairs, even though we had 30, 40 chairs at the site. So it could be busy, crazy at times. And it is, why do people last that long at WIC is because every time that we need to do a process to certify a person is not a fast or easy process. It's a lengthy process, and we want the families to know that. And that's why we're not able to just have everybody at once or come with many appointments. So we'll be selective and we'll start doing that. But, you know, we're welcoming them to this new WIC, which is really great that they get the card, they get things loaded, they can get, probably most of the referrals can be also be links on their phone and so forth. So, which is really nice. In my next slide, I am talking about receiving other WIC benefits, and we said, great. Other benefits, not WIC necessarily. Receiving other benefits, we say, great. Families should participate in every program that they could be eligible for. So if they're receiving other food benefits like Call Fresh, we're saying use your WIC first. Some things that we observe is that when families get Call Fresh and they get something else, they use, I think because of the higher amount, we don't know really. I'm just guessing when I'm saying because of the higher amount of the benefits that they cashed that one before. But they have a tendency sometimes to forget about using the WIC benefits. If they use it before, you know, they can complete healthy meals. I mean, if we help them think this way, if you're gonna make a spaghetti, well, buy your pasta with your WIC, you know, add in vegetables, buy them with WIC, and then get the meat with your Call Fresh, and you made a complete meal. So hopefully our families, you know, will do that. This is gonna help us keep it. This is gonna help us if they spend all their WIC foods, it will help us keep that benefit. So how do they apply for WIC? So in our agency, they can do it via text. They can just text apply to that number. They can do it online, or they can call at this number. And again, we have other WIC programs here in the area. And I think at the end, we're going to talk about how do we refer to each other. So you will have their personal information to their programs because of the area that they served, which will be really great for you to hear that. But if not sure where they live, you can refer them to My Family WIC California.gov. That will, by the zip code, it will direct them to the agency that is the closest to them. So follow us on social media. We have lots of information that we are giving out and providing through social media. Our handle is at PHFE WIC. So it's either all these logos right here, Instagram, Facebook, Twitter, Pinterest, YouTube also. We have videos on YouTube. We have our presentations, by the way, there. So if anybody wants to see them, we just did a webinar June 15th. Kiran did an awesome job also that webinar, giving information, almost the same information I'm giving you, but from Kiran's perspective. And it was a great webinar, and you can check it there. So we're saying, join our WIC family. You know, you're gonna be really welcome. Please tell your families, refer them, you know, they can come to us. We can work together through all these difficult times and help them and support them. Although we're not able to see them so much in person yet, but we will gradually start doing that. So WIC is here for you and your family. And we really mean that. We really care. You know, there are so many things within WIC that we did not really put in the presentations, but we have something called Sena Moms, which is a program that supports the breastfeeding for African American moms. We have the Fathers Program. We have so many other different things that the families can benefit from. So we welcome them, and we want to tell them again, WIC is here for you and your family. And I will welcome any questions. And I am going to put the slide, Steve, if you allow me, what I thought is like, you know, how do we continue from here? You know, so how do we support our programs and, you know, closing gaps, helping each other, helping moms and babies, and what outreach strategies do we use to continue working together? So if you want to take it from here, Steve, I'm fine.
Great. Okay. Thank you so much, Pina. Thank you. You said WIC is here for you. Thank you for being here for us. That was so much fantastic information. And I know we want to get into this discussion. That's helpful just leaving it on this slide here, because I know everyone wants to get into the referral process and how we can better support each other. But are there, I guess, first, any questions on the general updates that you had? I have one, and I'm sorry if I missed it, but I think there's a special farmers market benefit that WIC offers during the summer, right? Is that?
Yes. That benefit, let me stop. Oh, let me close this. I was gonna check. Okay, so yes, we have the farmers market checks. We just received the word that we just received them. Our agency is gonna be mailing them, and I will ask Irene and Claudia to share from their agencies, please. But PHFE is gonna be mailing those checks, so that benefit, and the question came, and I'm going to elaborate a little bit more on that. So one, are they receiving it? Yes. Is that in addition to the $35 that they get per person qualifying? Yes, that's additionally. But the thing is that the question that also came up was, can families use the WIC card or those $35 that they get in addition at farmers market? If they have a terminal to use the EBT card, yes. And I was told that more and more are doing that. So, you know, we were more limited last year, but this year I received a list of many of those who are getting it, the terminal to run the EBT card, so they can use both. They can use the farmers market, and they can use the $35 the WIC provides. So yes.
Perfect. Okay, great.
Great question. Thank you for mentioning that.
Thank you.
Pina, this is Irene. Do you want me to jump in for us on behalf of Lundquist? Okay,
yes.
Good. Yeah, we are also going to be distributing the checks, but we will be doing them. We will be doing mail outs and in person. We will be at 3 of our WIC farmers markets, which will be the one on Central Avenue. There's another one that's in Huntington Park and in Southgate. So we are going to be advertising that, I want to say, on Facebook and Instagram with our families, letting them know that there will be in-person distribution for those that would like to have that. You know, because sometimes people don't want to wait, because I know that last year, because of the pandemic, there was a lot of issues with the mail out. You know, families were saying they were not receiving their booklets over the mail. The post office was having, I guess, difficulties delivering everybody's mail. So there was a lot going on there. And so we decided this year that we would give the participants an option, whether or not they would want to go out to a farmer's market site location, or whether they would want us to mail out the checks. Yeah, and I also want to say that Pina, you're a great champion for WIC. You did a great presentation. She was very thorough in her presentation. I mean, she spoke for all of us, so it's amazing. It's good. It's like we have no more words from what you said, but you know, with our agency, yeah, we are going to continue to do things remotely, and we are going to do a soft launch, but I'm not too sure exactly when that's going to happen, whether it's going to happen in July or not, but it would be only by appointment. Yeah, and you know, we really encourage people to go online on our WIC for You website so that you can start the enrollment process.
Thank you, Irene.
I think
Claudia.
I'll leave it at that.
Okay, Claudia, do you want to add about your agency, about both farmers market, and how are you going to be seeing families?
Yes, good morning, first of all, everyone, and thank you for inviting me to this meeting. So the agency that I work for, Northeast Valley, we cover the San Fernando and the Santa Clarita Valley. We will be doing a soft opening starting July 6th, which basically means that for our agency, only first-time enrollments will be coming to the on-site. Other than that, group classes and also recertifications will continue to be processed over the phone. Now, starting in August, we'll be opening to see the annual recertification appointments. And again, it will be appointments only, group classes. They will continue to be processed over the phone. And we are currently referring all the participants that need a group class to the wicchealth.org website, so that way they could meet their nutritional quarterly contact. In regards to farmer market, 6 of the 11 offices for Northeast Valley, the agency, will be providing the farmers market. They would be put in the mail. We will not be we will not be able to give them the option to either come into the office. They will be automatically sent in the mail, and unfortunately, we will not be able to be present at any of the farmers market. Another thing I wanted to touch on was some of the resources. How do we provide resources? For example, such as Pina mentioned, we are, on Facebook. Northeast Valley is our parent agency. So for those individuals that are in need to apply, maybe for Medi-Cal, Cover California, or other programs, we do internal referral, and then we go ahead and we'll outsource the referral. We do have a presence in Facebook, Twitter, Instagram, and we also share flyers electronically with other community partners such as CCRC, UCLA Early Head Starts, providers in the area, CSUN, since we do have a satellite office at Cal State Northridge, Breastfeed LA, and at the same time, we will be participating in the Valley Presbyterian Hospital monthly baby showers, now that my understanding is that most likely they will be on site starting next month. Any other questions or any clarification?
I think that was helpful. Thank you for all that info too. Yeah, thank you so much for being here too, Claudia. Appreciate
You're welcome. Thank you.
Participation. Anyone else have questions related to WIC benefits? I guess before we get into the discussion of referrals and working together that way. All right, I don't see any in the chat either this way. So yes, it just means that you all, Pina, was a great comprehensive presentation, and great helpful info as well from Lundquist and Northeast Valley too. Thank you.